Hey guys, Don here. Welcome to the $1 Million Minute. I'm going to go over the things that helped bring to the $1 million mark. So a couple of good stories today. I was treating a patient today. He was actually a rep or a office manager from Athena. Now, I think you've heard before, I've recently switched from Athena to ModMed, or we're switching in April. So I was talking to the guys. I was pulling out his ingrown toenail, and I said, "Yeah, you guys just didn't adjust for me." And I explained the reason for him, and I said, "We produced about 4 million, and about maybe 1.4 of that was cash, and so Athena takes a portion of that in their percentage. And with ModMed, it was a lower monthly amount to use the EMR, but their percentage was only based on cash that went through like co-pays and deductibles and insurance and things like that. So he said, "Oh, I'm going to look into it. So we'll see if he comes back. I'll let you know if he comes back with anything." But I made a little graphic in my calculations worksheet. So if you want to see what that looks like, how I determined to go from one EMR to another, I put it in this little calculations worksheet to do that. So if you want that, just shoot me an email. The second thing, kind of a good thing that happened, is on our website, I have a page that says you can ask a question. And there was a patient that asked a question. Whenever they ask a question, I send them a quick email back, say, "Hey, yeah, I think you should come in." And so this gentleman did come in. He was one of the patients today. He came in. He had a kind of a cavus foot. He needed orthotics, and it was a kind of an easy patient. But he was appreciative of the ask a question portion on the website. I don't give out medical information per se. I might guide them to a video that they could watch and things like that. Excuse me. A bad thing that happened today is, or this day I'm recording, this was from Wednesday. There was a patient. I have a page. It's I give out now. So I've been using this page for a long time with plantar fasciitis. Or I'm sorry, with onychomycosis. It kind of goes through the whole process: phase 1, then phase 2, and so I give them this. And I wanted to make something similar because it was working so well. I wanted to make one for plantar fasciitis, so I made it. So I have phase 1 treatments. You all know it's like the foam rolling, night sprint, meloxicam, morning stretch, things like that. Phase 2 would be that, and then phase 3 are more the advanced things, such as like a plantar fasciotomy or some of these advanced types of surgical treatments. And then underneath, I had this course that I put together. I put this course together, I think it's been 5 years. Now, it really didn't get any traction, and I had a QR code. And so I've been giving out the sheet for the last few days. And unfortunately, I actually scanned the QR code on my own, and it went to my old domain, the Dr. Pelto domain, because I switched everything over recently. So all those ones never were able to look at the course. So I fixed that. So just something to keep in mind if you kind of are switching a website or you switch domains, or you have to kind of figure out things like that. And then finally, I think you heard my conundrum. I got censored or kicked off of the Google Business. So I only have 2 Google Business pages. One is for my my Worcester office, and one is for me personally. The other ones I've asked them to consider unsuspending me. I don't even know why I was suspended, but they suspended me. So what do we do in the meantime? I feel like our reviews went down, so we had to switch things all over to that one office. So through Swell, that's where we're doing our reviews. And then also I started a Google local, because I was thinking, well, what else would cause this little lack in patients? So we had openings in my Westboro office, and so I started this Google local business profile up again. Because I think even though when we tracked it, a lot of the patients that were clicking were already our patients looking for our phone number, I think it may have been getting more patients. So I'll let you guys know how that works. Okay, so those were the mistakes from today. So today was kind of a boring day. This doesn't happen all that often. I think it's because it's a second office, and also it's in the middle of January. So I had 11 appointments. They added some add-on patients here, but there were 11, and there was like 3 hours opening. So this is, it kind of, I don't know if you're like this, but you get a little scared when you have days like that. You kind of look, what am I going to do with my time? I'm going to drive my staff nuts. So what did I do? I tend to create or edit content when I have downtime, because otherwise I kind of go crazy. So I recorded some videos. I did edited some videos, and then I worked on some of the newsletter type of thing. So I try to keep busy during that time. What my mind tends to flow to is like, oh gosh, I need more referral sources and things like that, and then I just kind of go down this negative spiral. So I try to keep my head out of that. Maybe you can appreciate some of those feelings. Okay, so but I guess the benefit for the MVP, there were 4 orthotic patients I did. First patient, 49-year-old guy, IND, no follow-up. Second patient was plantar fasciitis number 1, shockwave. So she's gonna. She did number 1, which is the night splint, meloxicam, morning stretch, all those other things that I do. I'm going to see her back in 3 weeks for an ultrasound. Next patient, 66-year-old man. This is the one that came in because of the question he asked online, and he had PTTD. I did the number 1, which is very similar to plantar fasciitis number 1, and he got orthotics the first visit, and he'll be back in 3 weeks. Then there was a new patient that they kind of filled in a slot with here, and I don't quite remember, but I do have a note to call her, so I'm going to call her to see how she's doing. I think she had some type of a procedure in the office. Another patient that was a 68-year-old female that came in. She had a exostosis on the medial ankle. This was kind of interesting. I think it was like an enchondroma or something like that. I gave her an anti-inflammatory. I also did give her an injection kind of to the ankle region and around that area of the exostosis. She said when she was rollerblading, or her granddaughter was rollerblading, they whacked that area. So I don't think they can grow that fast, but that's what she had. I'm going to see her back in 3 weeks. Next patient was a EPAT number 1 with an orthotics. So she got orthotics this day, and I did the first shockwave. Another patient, 76-year-old female, for an ingrown toenail. Then another patient came in, 54. She was EPAT number 5 for plantar fasciitis. She's starting to feel a little bit better, which is a good sign. Another patient came in. This was the cavus foot. Cavus foot calluses, and then he got orthotics. So this is orthotic number 3. And then another patient came in for a 4th digit problem. Actually, it was a 2nd digit. He had a 2nd digit blood underneath the 2nd toenail bilaterally. So I did the shoe liner test for this patient. And this shoe liner test is where I take out the liner, have them stand on it, and I could see that there wasn't a finger's breadth of space at the front of the shoe liner. It was like a sketcher. And so I said, hey, you need to go up a half size, because I think that's what caused the blood underneath the nail. So I kind of popped the blister there that was underneath the nail, and then the blood that was underneath the nail, the color normalized, and then that should be fine. I gave him the option of avulsing the nail, but we opted not to do that. And the next patient, where are we at here? So the next patient was orthotic number 4. This was a patient that had metatarsalgia, 79-year-old patient, and they decided to get orthotics. And then last couple were ingrowns. There was an ingrown patient that got bilateral partial nail avulsions. And then finally the last patient was a 39-year-old female that was treated for hallux limitus. She has some functional hallux limitus. She was treated with correct toes and more anatomic shoes. I think she got some Blenkas or groundies or something like that. Those are some anatomic shoes that I recommend. And she's feeling much better, as well as she got some physical therapy. And she'll follow up as needed. So that was the day. Those are the kind of the stressors of the day. I'd love to hear some of your questions or thoughts for me. Don at podiatrypracticemastery.com. I always like to share kind of both the good things and the bad things, because I think in our practice we all have kind of bad stuff that happens, and I think 3 hours is bad. Okay, have a good one. Bye-bye.